Homeo Guru. Please subscribe our channel, press bell icon to get continuous updates about new videos. Exam Oriented Video Part 57 MCQs. All are cardiotoxic except aconite, opium, oleander, nicotine. Answer: opium. Sheehan syndrome is pituitary necrosis, adrenal necrosis, pituitary adenoma, adrenal adenoma. Answer: pituitary necrosis. Total number of chapters in Ken repertory: 37, 27, 39, 32. Answer: 37. Double bubble sign is seen in pyloric stenosis, duodenal atresia, jejunal atresia, CA stomach. Answer: duodenal atresia. Truck strength of causticum: 1 by 20, 1 by 2, 1 by 1000, 1 by 5000. Answer: 1 by 2. Diplopia: one image is seen below the other. Oramet, lithium carp, lycopodium, syphilinum. Answer: syphilinum. Inferior rib notching is seen in RA, SLE, scleroderma, coarctation of aorta. Answer: coarctation of aorta. Sunburns are first degree, second degree, third degree, fourth degree. Answer: first degree burns. IPC 82. Child cannot be punished under 10 years, 7 years, 12 years, 15 years. Answer: 7 years. Disease caused by bacteria in human eye: xerophthalmia, glaucoma, trachoma, and cataract. Answer: trachoma. Least affected organ in blast injury: lungs, liver, omentum, ear. Answer: liver. Largest skull diameter is mentovertical, occipitofrontal, suboccipitofrontal, suboccipitobregmatic. Answer: mentovertical. After camphor in cholera and cholera morbus: Cicalcor, Asalb, Veratrum album, Baptisia. Answer: Veratrum album. Two identical tints will not have same iris color, fingerprint, blood group, DNA copies. Answer: fingerprint. Colic after lithotomy or ovariotomy: bismuthum, hepasulf, both, none of these. Answer: both. Rat tail appearance on barium swallow is seen in Aglacia cardia, CA esophagus, hiatus hernia, all of the above. Answer: CA esophagus. After overaction from repeated dose of belladonna in whooping cough. Spongia, Heparself, Stramonium, Hyoscyamus. Answer: Stramonium. Fingerprints are permanently altered by eczema, leprosy, tuberculosis, all of the above. Answer: leprosy. Is recommended as a prophylactic in malarial and African fevers. Belladonna, cinchona, terebinthine, and sulfur. Answer: terebinthine. Fundamental rules of preparation of drug in Class 1. Belladonna, thuja, arsal, petroleum. Answer: belladonna. Thank you.